Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm going to be covering skin disorders, and to be more specific, I'm going to be going over burns and pressure ulcers. If you haven't done so already, guys, please don't forget to like and subscribe below. Don't forget to press that notification button so every time a new video is released, you'll be notified. Also, guys, don't forget the information I cover here on YouTube is going to be different than what you see me covering on other platforms such as my TikTok account, Facebook or Instagram. So make sure you check that out, as well as my other resources I have available for you on my website, nexusnursinginstitute.com. Okay, guys, without any further ado, let's get started. First question. The client comes into the emergency room in severe pain and reports that a pot of boiling hot water accidentally spilled on his lower legs. The assessment reveals blistered, mottled red skin, and both feet are edematous. Which depth of burn should the nurse document? 1, superficial partial thickness. 2, deep partial thickness. 3, full thickness. Or 4, first degree. And guys, the correct answer is 2, deep partial thickness. So guys, with this type of burn, the epidermis is involved, sometimes a little bit deeper, guys. And what you're going to see, the patient's going to have painful blisters, just like they say here, that it's painful with the blisters, and you'll see mottled skin. Okay, so that is describing deep partial thickness. Now let's talk about our other choices, the ones that are wrong. 1, superficial partial thickness. When you see superficial partial thickness, that's also known as what? First degree burns. So how would that be described? Excuse me. The epidermis is affected, because remember, this is only first degree. The epidermis is affected, and the skin's still going to blanch with pressure, okay? Full thickness, not only is the epidermis affected, the entire dermis is affected. So it goes down deeper, guys. Sometimes the subcutaneous tissue, even down to the muscles, can be affected. Last, first degree. What is first degree? What did I tell you first degree is also known as? That's your number 1, your superficial partial thickness burn. So guys, you absolutely must know the difference in these types of burns and what they're going to look like and the descriptions, guys. Next question. The client with full thickness burns to 40% of the body, including both legs, is being transferred to a community hospital, from a community hospital to a burn center. Which measures should be instituted before the transfer? 1, 22 gauge IV line with normal saline infusing. 2, wounds covered with moist sterile dressings. 3, no IV pain medication. Or 4, adequate peripheral circulation to both feet ensured. And guys, the correct answer is 4, adequate peripheral circulation to both feet ensured. Why? Well, whenever you get a question asking you about a priority, what's going to be the most important thing to do, the first things that needs to be going on in the back of your mind is going to be physiological integrity, whatever is physically keeping that patient alive and safe. So what covers physiological integrity? Fluid and electrolytes, glucose, nutrition, airway, breathing, circulation, right? Circulation, their hematologic status, right? Vital signs, whatever is physically keeping this patient alive. So look at number 4, adequate peripheral circulation of both feet. We need to make sure that that patient is getting the oxygen, the vitamins, the nutrients, the minerals, everything that's being carried in the blood, that it's actually circulating and going to the tissues so those tissues do not die off, right? So that's going to be our priority in the choices that have been presented to us. So now let's look at the wrong answer choices, guys. 1, 22 gauge IV line with normal saline. First of all, the gauge is going to be 18, right? Remember, when a patient experiences a large burn, there are 3 concerns that we're going to have. Our biggest 3 concerns. Dehydration. Why? Because of the huge fluid shift. All of that fluid is going to want to leave the vascular space, go out into the tissue. So even though the patient looks edematous, they're swollen all over, they're actually dehydrated. There's no fluid in the vessels, which means those tissues, the organs are not being perfused. The patient can go into shock, right? Our next concern, infection. If a patient has a burn, their first line of defense, which is the skin, has been damaged. So we're concerned about infection. And the third thing we're concerned about when it comes to burns What is my third thing? Infection, hemorrhage. Infection, hemorrhage. What's my third concern with burns? It'll come to me, guys. It'll come to me. But there's a third thing we're concerned about burns. But anyway, for choice number one, 22 gauge because we're giving them 18 gauge because we're going to be giving them lots of fluids. Remember, they're at risk for shock. We don't want them to go into shock. And look how it says normal saline. No. What type of fluids are we going to give a patient that has major burns? Lactate ringers. Lactate ringers, because that's what most closely what's the word I'm looking, looks like our blood. Okay, lactate ringers. That's what you're going to give them, not normal saline. So that's number one's wrong. 2, wounds covered with moist sterile dressing. Now look how they try to trick you, because you see that word sterile in there, and we know that when it comes to burns, one of our major concerns is infection. Yes, everything's going to be sterile, but we're not going to be covering wounds with moist sterile dressings. No, it's going everything that goes on that wound is going to be sterile, absolutely, but it's not going to be moist. Okay, and most often what we're going to do is if that wound has to be covered, it's going to be covered with a dry sterile dressing, not moist. 3, no IV pain medication. Excuse me, let me tell you something. Pain never killed anyone except in certain situations, which include myocardial infarction, sickle cell, stones, and burns, right? And when I say never killed anyone, I mean that pain can be so severe, it can physiologically change that patient's status for the worse, and burns is one of them. So pain has to be addressed, right? And we're not going to be giving this patient, little NSAIDs. No, we're giving them the big guns. This patient will be on something like morphine. So choice number 3 is 4. So choice number 3 is wrong. So the correct answer is 4, because 4, when we're talking about circulation, that is part of the patient's physiological integrity. So that's going to be a priority for us. Number 3. Oh, by the way, guys, I don't know why, but I'm having this brain fart. If anyone remembers, because I talk to you about this all the time. So if anyone watched my other videos and remember what my third concern that I always tell you is for burns, if you can remember, go ahead, drop it in the comment section for me, because I'm having just a brain fart at the moment. Hopefully it'll come back to me before the end of this video. Oh, and if you haven't watched any of my videos and you want to know what that third thing is, if I can't remember, go ahead and look in the comments. I have lots of avid followers, and I'm trusting you, my students, to remember even when I can't. So make sure you guys check out that comment section. All right, the client has full thickness burns to 65% of the body, including the chest area. After establishing a patent airway, which collaborative intervention is priority for the client? 1, replacing fluid and electrolytes. 2, preventing contractures of extremities. 3, monitoring the urine output hourly. Or 4, preparing to assist with an escharotomy. Okay, guys, and the correct answer is 1, replace fluids and electrolytes. Why? What did I just tell you, right? When it comes to physiological integrity, one of the things I mentioned is fluid and electrolytes, right? If that is off, that can cause the patient to literally die. So let's go back to the question. Look what it says, because it gave us some, hints. It said that the patient has 65%, burns to 65% of the body, including the chest area. Whenever you get a test question about a burn chest area, your very first concern is going to be airway. Airway, circulation, all of that stuff falls under physiological integrity. But if you have to choose between airway, nutrition, fluid and electrolyte, circulation, vital signs, airway is going to come first. That's why they said after establishing airway. So we took care of that. We made sure the airway was patent, right? After establishing a patent airway, which collaborative? That means to work with somebody else. So it's not me doing it by myself. Which collaborative intervention is going to be a priority for the patient? And the answer is replace fluid and electrolytes, because you do need a doctor's order for that, right? You can't do that. It's not independent. You can't do that on your own. So it's going to be a priority, but it's going to be a priority that you need a doctor's order for. It's not something that you can do independently. Now let's look at our other choices. 2, prevent contractures of extremities. That's something that you can do independently. It's not a collaborative effort. 3, monitor the urine output hourly. That's something you can do independently. It's not a collaborative effort. 4, prepare to assist with escharotomy. Now, preparing to assist with escharotomy, yes, that's a collaborative effort. It's not something that you're doing independently. That is true. But number 1, that's not going to be our priority over fluid and electrolytes, because what's going to kill the patient faster, fluid electrolytes or the eschar tissue? Fluid and electrolytes. That's number 1. Number 2, preparing for escharotomy, this patient just got the burn. There hasn't even been time for that eschar tissue to develop. So that still wouldn't be a priority. Do you guys see why number 1 outweighs everything else? And guys, this is how you're supposed to be thinking when you're looking at these test questions, okay? Next question. The client scheduled to have a xenograft to the left lower leg burn. The client asked the nurse, "What is a xenograft?" Which statement by the nurse would be the best response? 1, the doctor will graft the skin from your back to your leg. 2, the skin from a donor will be used to cover your burn. 3, the graft will come from an animal, probably a pig. Or 4, I think you should ask your doctor about the graft. And guys, the correct answer is 3. The graft will come from an animal, and most likely will be from a pig. That is what the xenograft is. Now let's look at the wrong answer choices. 1, the doctor will graft skin from your back to your leg. That is an autograft, auto, from self. You're just getting skin from your own body and putting it somewhere else. 2, the skin from a donor will be used to cover your burn. That's the homograft, so that graft will come from another human donor. And choice 4, I think you should ask your doctor about the graft. That's passing the buck. Why would you pass the buck? I always tell you guys, never pass the buck. If the patient asks you a question that you have the ability to answer, you must answer that question. Don't ever pass the buck. Don't ever pass the buck. The only time you do not answer a question, the only time you refer the patient to go speak to their doctor is if something is out of your scope of practice, right? It's something that you cannot discuss with that patient. Then you refer them to the specialist or the doctor. The ICU burn nurse is developing a nursing care plan for a client with severe full thickness and deep partial thickness burns over half the body. Which client problem has priority? 1, high risk for infection. 2, ineffective coping. 3, impaired physical mobility. Or 4, knowledge deficit. And guys, the correct answer is 1, high risk for infection. Let's go back to the question. It says, which client problem has priority? Remember what I said, guys. Whenever you're being asked about priority, you always need to think about what will kill the patient the fastest. Let's look at this list. Between risk for infection, ineffective coping, impaired physical mobility, and knowledge deficit, what would kill a patient faster? 1, high risk for infection. That infection like that can turn septic and kill that patient. That's going to be our biggest priority. Remember, guys, when I said when it comes to burns, your biggest concerns, and I can't remember my third, your biggest concerns is going to be dehydration. It's going to be dehydration, infection, and of course pain. I've just been talking about it. All right. That's one of the worst pains that a patient can ever have. So that absolutely has to be addressed. All right, guys, next question. The nurse writes a nursing diagnosis, impaired skin integrity related to open burn wounds. Which intervention would be appropriate for this nursing diagnosis? 1, provide analgesia before the pain becomes severe. 2, cleanse the client's wounds, body, and hair daily. 3, screen visitors for respiratory infection. Or 4, encourage visitors to bring plants and flowers. And guys, the correct answer is 2, clean the client's wounds, body, and hair daily. Let's go back to the question. There's a portion of the question I want to bring to your attention where it says the nursing diagnosis is impaired skin integrity. Let's stop right there. Remember, whenever the skin integrity is impaired, one of your first concerns is going to be infection, because the first barrier, the first protection against infection is your skin. So let's go. Impaired skin integrity related to open burn wounds. So we're concerned about, for example, staph. Staph naturally is on the skin, right? It doesn't harm you. However, if your skin integrity is damaged, such as a burn or a cut, you're immunodeficient, and that staph that always sits on your skin that never harms you now gets inside of your body, that can cause you to have a very, very, very bad infection. So number 2 is our answer. We're going to cleanse the wounds, the body, and the hair daily. Why? We want to decrease the number of pathogens to decrease the risk of that patient getting an infection. Guys, it's always easier, it's always better to prevent infection than to treat infection, okay? Let's look at our wrong answer choices. 1, provide analgesia before the pain becomes severe. What does that have to do with infection? That's about pain. 3, screen visitors for respiratory infections. Well, that's great and all, right? But number 2 is still better, to protect that patient from infection. Decrease those pathogens. Number 4, encourage visitors to bring plants and flowers. Really? Plants and flowers that have little bugs on them? Plants and flowers that have pathogens? How's that going to help us decrease those pathogens on that patient's skin? No. Number 2 is a correct answer. We want to cleanse those body parts, including the skin and even the hair surrounding that wound. Which nursing intervention should be included for the client who has full thickness and deep partial thickness burns to 50% of the body? Select all that applies. Okay, guys, how do we treat select all that applies? As true or false? Let's go. 1, perform meticulous hand hygiene. True. Why? We want to decrease the risk of infection. 2, use sterile gloves for wound care. True. We want to decrease the risk for infection. 3, wear gown and mask during procedures. True. We want, not only do we want to decrease the risk for infection, right? How? Think about it. You're wearing a mask and gown. You don't want anything on you to possibly get into what? That wound. Absolutely true. 4, change invasive lines once a week. False. Remember, infection is a huge priority in these burn patients. So how often do you think we're going to be changing these invasive lines, which are very easy for pathogens to get into that patient's body? Daily, every single day. So that's false. 5, administer antibiotics as prescribed. True, absolutely. Why? We want to decrease the risk of infection. You guys starting to notice a common theme going on here, guys? The nurse is caring for a client with deep partial thickness and full thickness burns to the chest area. Which assessment data would warrant notifying the healthcare provider? 1, the client's complaining of severe pain. 2, the client's pulse ox reading is 95. 3, the client has a temperature of 100.4, respiration 100, pulse 100, respirations 24, and blood pressure 102/60. And 4, the client's urinary output is 50 milliliters in 2 hours. I'm sorry, guys. I was reading these choices, but something just came to my head. I'll talk to you about it in a second. Okay, so the correct answer, guys, is 4. The client's urinary output is 50 mLs in 2 hours. Why? We're concerned about shock. Shock is actually our 4th thing we're concerned about when it comes to burns. I'm going to talk to you guys about that in a minute. Well, let me talk to you about it now. Remember how I said there were 3 things? It's actually 4 things. Why? Because shock, which was really my 3rd, I talked to you about pain. So let's talk about it. A person has burns. Yes, we're concerned about infection, 100%. We're also concerned about shock. Why? Because what happens is when a person has burns, all of the fluid that were in the vascular space, it goes out into the tissue. So even though patient looks swollen, they're what? Dehydrated. They can go into shock. So we're concerned about infection. We're concerned about shock. And what's my 3rd one I just had? Burns, infection, shock, which is my dehydration. I guess it is the pain. I can't wait to see the comment section, guys. because I'm crazy this afternoon. We'll see. All right. So let's talk about urine output. The urine output is supposed to be at least 30 milliliters per hour, right? Anything less than that, what happens? Those kidneys start to shut down because your body's going to try to protect you no matter what. So when the body does not have enough perfusion, your organs are not being fed enough, one of the first things to happen is those organs start to shut down. And so you're going to see the urine output start to go down because those kidneys are shutting down because there's not enough perfusion going on. So the client urinary output is 50 mLs in 2 hours. In 2 hours, that urine output should be at least what? It should be at least 60 mLs. So the fact that you see this patient's not even giving you 30 mLs per hour, you need to be calling that doctor to say, hey, I'm looking at this urine output and it's going down. This urine output isn't even giving me 30 mLs per hour. What are we concerned about? That patient going into shock. Okay, what do we expect? We expect to see those measures for the patient going into shock, including giving that patient fluids, right? We're going to call the doctor about that. You have to suspect shock. Now let's look at our other answer choices. 1, the client complaining of severe pain. Yes, that's a problem, guys. And when the patient has severe pain, you know something's wrong. That is a priority. But when you have to choose between severe pain and that patient going into shock, that's number 4. Number 4 doesn't say the patient's going to shock, but them having the urine output of less than 30 mLs per hour lets you know that patient's going to shock. It lets you know that patient's not being perfused enough that those kidneys have to shut down. When you have to choose between those two, pain and those kidneys shutting down, those kidneys shutting down are going to be your priority. Okay? So yes, number 1 is a problem, but it's not as big as a problem as our number 4 is. Let's look at number 2. The client's pulse ox is 95. Okay. Preferably, guys, we want the pulse ox to be between 98 and 100, but we will accept anything that's 95 or higher. So that's not somebody we're going to be running to. We're not going to be calling the doctor about that. Choice 3, the temperature on 100.4. And okay, you guys see these vitals. Now, the temp of 100.4, so we see a slight elevation in the temp. So that does have to be addressed, but it's not life-threatening. Choice number 4 is life-threatening. Choice number 4 may kill the patient, and that's why it's going to be our priority. I promise, every time you see a test question asking you about a priority, always say to yourself, which one will kill my patient the fastest? And that's going to be your priority. Okay, guys? Next question. The client admitted with full thickness and partial thickness burns to more than 30% of the body. The nurse is concerned with the client's nutritional status. Which intervention should the nurse implement? 1, encourage the client's family to bring favorite foods. 2, provide low-fat, low-cholesterol diet for the client. 3, monitor the client's weight weekly in the same clothes. Or 4, make a referral to the hospital social worker. And guys, the correct answer is 1, encourage the client's family to bring favorite foods. Whatever their favorite foods are, whatever that patient's willing to eat, we're going to give it to them. Why? Because nutritional status is a big deal with this patient, guys. This patient has huge burns. We're worried about fluid and electrolytes because there's a big shift. We want to get that nutrition into the patient. Why? Nutrition, isn't that part of physiological status? Isn't that one of the things that can literally kill a patient if the patient doesn't have enough of it? It is. That's going to be a priority for us. Now, let's look at our wrong answer choices too. Provide low-fat, low-cholesterol diet. No, the diet that we want to give this patient is going to be a diet that's high in vitamins, right? Why? Remember, those vitamins and minerals and nutrients that are in the blood that are supposed to be traveling in the blood vessels have all shifted out into the tissues, which makes that patient severely makes that patient severely deficient of those nutrients. So we need to replace them. So we're going to give them a diet high with vitamins. We're going to give them a diet high with vitamin C. Why? Vitamin C is good for what? Healing. We're going to give them a diet high in proteins. What is protein good for? Wound healing. We're going to give them a diet high in calories. Why? Calories give you what? Energy. Energy for what? Wound healing. That's the type of diet this patient's going to be on. So anything that patient's willing to eat, we're going to give it to them. Choice number 3, monitoring their weight weekly in the same clothes. No, we're going to be monitoring their weight daily. Every single day. We're taking daily weights on this patient. Again, guys, nutritional status and the fluid electrolytes is so important for this type of patient. Make a referral to the hospital social worker. No, a referral to the dietitian, because we have to make sure that we're getting the correct amount of vitamins and nutrients into that patient, as well as the minerals. Okay? So the correct answer for that, guys, is number 1. All right, next question. The nurse in a long-term care facility is teaching a group of new unlicensed assistive personnel. Which information regarding skin care should the nurse emphasize? 1, keep the skin moist by leaving the skin damp after the bath. 2, do not rub any lotion on the skin. 3, turn the clients who are immobile at least every 2 hours. Or 4, only the licensed nurse staff can care for the client's skin. And guys, the correct answer is 3, turn clients who are immobile at least every 2 hours. Why? We want to prevent we want to protect the patient's skin integrity and prevent that patient from getting ulcers. So that patient's immobile, they can't move themselves. You have to move them. You have to turn them at least every 2 hours. Now let's look at the wrong answer choices. 1, keep the skin moist by leaving the skin damp after the bath. Actually, keeping that skin moist, that's what promotes skin breakdown. That's why that patient who's immobile or at risk for skin ulcers, we want to keep their skin dry. That's why as soon as they urinate or they have a bowel movement, we clean them up, because that sitting on the skin will cause the skin to break down. So that's false. 2, do not rub any lotion on the skin. No, we want to rub lotion on their skin. We want their skin to be moisturized, but not moisturized with urine that's acidic, that's going to break down their skin, not moisturized with feces, not even moisturized with water just sitting on the skin that will break it down. But with lotion, moisturization, yes, we want that. Why? Another thing that can cause skin breakdown is when their skin's too dry. If their skin's not moist, it hasn't been moisturized, it's too dry, it's very easy, guys, for that skin to open up. And before you know it, that patient has a pressure 1 skin ulcer. So choice 2 is wrong. You're not going to tell them not to put lotion. We want them moisturized. Choice 4, only. Let's stop right there. What have I told you about only? Only, always, never, all inclusives. Stay away from them unless you know that's the answer. Only the licensed nursing staff can care for the client's skin. Excuse me? No, this is a team effort. We're all caring for that client's skin. So the correct answer, guys, is number 3. The nurse is caring for a client who's developed a stage 4 pressure ulcer on the left trochanter and coccyx. Which collaborative problem has the highest priority? 1, impaired cognition. 2, altered nutrition. 3, self-care deficit. Or 4, altered coping. By now, I know you've all chosen the correct answer, which is 2, altered nutrition. Our priority is always going to fall under physiologic status. Again, guys, glucose, vital signs, ABC, hemodynamic status, nutrition, rest, right? Anything that will physically kill or keep your patient alive, that's always going to be your priority. When you look at this list, guys, what's it going to be? Altered nutrition. That is our priority. You know, choice number 1, 3, and 4, all of these need to be addressed, but they are not going to kill our patient as fast as altered nutrition will. And that's why number 2 is our correct answer, guys. The nurse is caring for clients in a long-term care facility. Which is a modifiable risk factor for the development of pressure ulcers? 1, constant perennial moisture. 2, ability of the clients to reposition themselves. 3, decreased elasticity of the skin. Or 4, impaired cardiovascular perfusion of the periphery. And guys, the correct answer is 1, constant perennial pressure. Why? Let's go back to the question. It says, which is a modifiable risk factor. So not only what's a risk factor, which is a modifiable risk factor. That means which is a risk factor that can be changed, that you can do something about, which is a modifiable risk factor. So when we look, number 1, constant perennial moisture. Isn't that something that you can do something about? Yes. As soon as that patient urinates on themselves, right? you're gonna change them. Don't let that urine just sit on their skin and cause tissue breakdown. As soon as that patient has a bowel movement, you're gonna clean them up. Don't let that feces just sit on the skin and cause tissue breakdown. But let's look at our other choices, guys, the wrong answer choices. Ability of the client to reposition themselves. Is that modifiable? You can reposition the client, but if patient's unable to reposition themselves, right? They can't do it. That's not modifiable. 3, decreased elasticity of the skin. So the patient has wrinkles, their skin isn't tight again anymore. Is that anything that they can do to change that? No, that's not modifiable. 4, impaired cardiovascular perfusion of the periphery. So that blood flow going to those tissues in their lower extremities. Is there anything that they can do to change that? No. But number 1, there is something that can be changed. Constant perineal moisture, they can be changed often, right? They don't have to have that urine and feces sitting on their skin. And this is why number 1 is the correct answer. You want to keep your patient clean and dry. What is the scientific rationale for placing lift pads under an immobile client? 1, the pads will absorb any urinary incontinence and contain stool. 2, the pads will prevent the client from being diaphoretic. 3, the pads will keep staff from workplace injuries such as pulled muscle. 4, the pads will help prevent friction shearing when repositioning the client. And guys, the correct answer is 4. The pads will help prevent friction shearing when repositioning the client. So guys, it keeps that skin from pulling when you're pulling the client up or down. And that's going to help prevent those ulcers. Let's look at the wrong answer choices. 1, the pads will absorb any incontinence and contain stool. That's true. That may happen, but guess what? It will also keep that urine or stool that it contained against the client's skin. How's that going to keep the client from getting a pressure ulcer? It won't, so it's false. Choices 2, the pads will prevent clients from being diaphoretic. That means from being sweaty, right? That's false. Choice 3, the pads will keep the staff from workplace injuries, such as pulling a muscle. Number 1, that's false. And number 2, the question's asking about the patient, how we're going to keep the patient from getting a pressure ulcer. It has nothing to do with the staff. So that's false. All right, guys, we are down to our very last question. The paraplegic client is being admitted to a medical unit from home with a stage 4 pressure ulcer over the right ischium. Which assessment tool should be completed on admission to the hospital? 1, complete the Braden scale. 2, monitor the client on a Glasgow Coma scale. 3, assess for Babinski sign. Or 4, initiate a Brudinsky flow sheet. And guys, the correct answer is 1, complete the Braden scale. Why? That assesses for skin problems. So of course, that's what you're going to want to do. You want to assess that patient for skin problems. Now let's look at our wrong answer choices. 2, monitor the client on a Glasgow Coma scale. What does that monitor? That monitors neurological deficits, right? If the patient's fully awake, alert, responding to if they're in a coma. So that's the wrong answer. 3, assess for Babinski sign. How? If you go back to the question, it tells you that what? They're paraplegic. This client's paraplegic, so how are we going to do that? How's that going to work when those nerve pathways are not working? So that's false. And choice 4, initiate a Brudinsky flow sheet. That actually is assessing for what? Meningitis. So guys, our correct answer is number 1. We want to assess the risk for that patient having skin problems. Guys, I hope you found this video to be helpful. If you'd like to see more on burns or pressure ulcers, please let me know in the comment section and I'll make sure I make a follow-up video for you. Please don't forget to check out my additional resources I have available for you guys, my audio lessons, which are on my website, nexusnursinginstitute.com. Check out my other social media platforms if you want to practice more questions different than what I do here on TikTok. You can check me out on Instagram, on Facebook, on TikTok, and I'm missing one. What else am I on? Instagram, Facebook, TikTok. those three, I guess. Oh, don't forget about my podcast that I have, guys, also called Nexus Nursing. Thank you for sharing this time with me. You'll be seeing me on the next video.